is not plugged in. Can anybody hear me? Anybody hear me? You can, because I can't hear. Okay, okay. So they can hear me, but oh, I hear. Okay.
Probably is new. I don't know if I remember the lady's name that was working there. Maybe it's new assistant.
Yeah, Bruce.
Yeah.
He's there right next to the left man. He's not there.
Yeah,
Right
but she was in his room setting up his computer, Bruce's computer.
Oh, well, Dustin's things that are.
Oh, Dustin,
Bruce's camera's on. Who's that behind?
Cindy said she was ready.
Oh.
Tim can't stay on after this for an agenda meeting.
Well, what do you do? His wife.
He can just respond. I stay on right after this to do the agenda meeting, but he already had them, so.
I didn't see that. That's nice.
Yeah, they can.
How do we tell if one of those cell phones is Heather? She was gonna call her, she didn't have her camera set up.
Will just be another one down there.
We'll do a roll call, so she'll be over here. Sam, you tell me when you're ready.
Whenever you say it's all ready to, oh, somebody's coming in, Tammy. You tell me and we can make it happen. I have the flag ready to go.
Yeah, well, I'm ready. All right, good morning, everybody. Can you hear me?
Yes.
Can hear you.
All right. Well, we're waiting for Heather to log on. She's not by picture, but we'll be able to hear her. There's nothing we're going to vote on, so we will just call the meeting to order, and let's stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now here's Heather for just a minute. Yes, Heather. Oh, okay. All right. We're going to go ahead and do the roll call. Chandra?
Is Heather not on here yet?
No, I would start with you.
I think Sam is working on it, so she'll not be here yet.
Okay, Alderman Flores?
Here. He's not sworn in yet, but he will be shortly.
Alderman Galloway? Alderman Galloway? Bruce?
Can you all hear us?
Yes, I can hear you.
Bruce can't hear us. Bruce, can you hear us?
Hey, Ted, you're on the window next to Bruce. Why don't you knock on the wall?
Yeah. Can you knock on your screen and get Bruce to answer? Cindy can't hear anything either. It looks like Cindy's muted. Cindy?
I can hear now.
Oh, okay, there you go. Thank you.
Mm-hmm.
We're just getting everybody started. I'm gonna text Bruce real quick and tell him he's muted, so.
Do we want to though? Do we?
Good question.
Oh, gosh. Anybody know sign language? Hey, Bruce.
Yeah, okay, I hear you.
All right, hey, Bruce is unmuted, all right. go ahead, Chandler.
All right, Alderman Galloway,
Here.
thank you. Alderman Poston,
Here.
Alderman Schaefer,
Here.
Alderman Smith.
Here.
All right, we're all present, we have quorum.
Heather, are you there? Can you hear? Well, Sam's working on that, so, this technology thing is interesting. Thank you all for your patience. Hopefully we'll be out of this soon. Okay, we have a quorum. First thing on the agenda is to swear in our new alderman. So I'll turn this over to Chandra and Mr. Forrest. So I'm sure you all have met RJ Forrest. If not, why, this is your chance. He's, as you know, has been on the Planning and Zoning Commission for some time. So, all right, Chandra.
Raise your right hand. All right, do you? Take your hand.
Richard Forrest, Jr.
Solemnly swear or affirm that in my duty as alderman of the city of Ozark, I will support the Constitution of the United States, the Constitution of the state of Missouri, and the ordinances of the city of Ozark, and the laws of the state governing the cities of the fourth class. That I am not indebted to the city of Ozark in any manner, and that I will faithfully demean myself in my office and discharge my duties according to the ordinances of the city of Ozark, beginning the 29th day of April 2020. So help me God.
I do.
All right. Congratulations.
Thank you.
All right.
Thank you. Congratulations, Mr. Forrest.
Thank you, Mr.
And
Mayor.
it's official.
All right, we are now up to a full complement of older people, wherever you are. Okay, thank you, Steve.
Okay, everyone, we have a couple of agenda items, and the first agenda item is we have, we both actually have guests, and this morning our first guest is Cindy Ballou with the Christian County Health Department. Cindy is also joined by Karen Peak. Karen is going to be the incoming director of the Christian County Health Department, and we wanted to take the opportunity today to just visit with them. It has been a very long 30 to 45 days for everyone. And Christian County Health Department has certainly been through a lot as well. We rely on them for so much. We work with them day in, day out. And I felt like, based on the questions last time, it would be a great opportunity for our Board of Aldermen to be able to visit with the Christian County Health Department and ask any questions that they may have. I know Cindy is going to give you an update on just how the information flow chart works from the state level down to the county levels and then back up and down into our first responders. So Cindy, I'm going to turn it over to you and just let you give us the update of where we're at and kind of the process of how dealing with COVID works from a Christian County Health Department standpoint, and then allow for the board to ask any questions. Is that okay?
That will be just fine.
Okay, you got the floor.
Okay, good morning, everyone. I did want to introduce our incoming administrator. We are both on phones because we're going to be working through the night tonight on training. It's a little hard to do that while we're in the office. So Karen Peak is joining me this morning, and I will refer part of your questions to her, and I'll be able to take care of part of them myself. As far as Steve put out there, the first question has to do with the conveyance of information. And the way that works is that we will sometimes, not always, there's a lot of sometimes in this particular situation we've got going on, but physicians are supposed to send us a form when they have someone there that they are going to test. It's a person under investigation form. And so if we get that, and like I say, the private labs are not sending those, and so there's a lot of frustration involved with that. But when we get those, then our nurses immediately begin an investigation. They call the person who's under investigation. They find out their signs and symptoms, who they've been in contact with. We immediately start to put together, a plan for this particular patient, and it happens with every patient that we know about. If that patient ends up being positive on their test, then we will get both a call and an email from the state health department, and we get that especially the call almost immediately. I have gotten multiple calls at 2 o'clock in the morning, 3 o'clock in the morning, because it is, what they have decided to do is to notify immediately so we can get on it immediately. Whenever that happens, then our staff immediately goes to work on, okay, this is a positive. This isn't something that we've got sitting over here and we kind of know what's going on with it. It's okay, we're going to put our efforts there. And so they begin that investigation. As soon as they are able to confirm with, paperwork from either the physician, the lab, or the state, then I put together a message and send it to Samantha. And thank goodness for Samantha. She has been so helpful to us during this entire ordeal, as far as having all of her media lists and county leaders lists and whatnot all put together. She gets that information out for us. She puts it on our Facebook. And so we're able to go about it like that. Normally, our nurses also get a call from the regional office of the Missouri Department of Health. And so they work a lot with the epidemiologists in that office. So does that answer that question? Hello?
It does, but we're
Yeah.
going to let the board ask questions. Board, does anybody have any questions for Cindy about process?
I have a follow-up on that one. So what about the release of the information? Obviously, you're not going to release names or that type of information, but sometimes it seems like we're told about the travel habits of a positive case, and sometimes we're not. How is that decision made, and how's that information conveyed?
That decision is made from county to county. We have chosen not to do that if the risk is extremely low. And the reason for that is because it sometimes gives people a false sense of security or a false sense of panic. Like, for example, if we say that this positive case was at Lowe's on Thursday and they think they were there about 3 o'clock in the afternoon, then some people get the idea, well, I haven't heard of anybody over at Lowe's that's had it, or, over at Walmart that's had it. They've had it at Lowe's. Let's stay away from Lowe's. Or others are like, oh my gosh, I was there. I've got to call the health department. I'm going to have COVID. And actually in those environments, it's an extremely low risk. CDC tells us that in order to transfer COVID, then far and wide, the mode of transmission is going to be through the droplets and, in the air. And so that's why we have chosen not to do that. For one thing, there's also multiple places these people have been before they realized that they were positive. And it just gets extremely confusing. It gives a false sense of security to some people. We have lots and lots of people who want to know, what city are these people from? Are they all in Ozark? Are they all here? Where are they at? And they will tell us just flat out, if you tell me that there's COVID, more of it in Ozark, then I'm going to go to Walmart in Nixa. And there's just no reason to that. The cases we have so far are not community spread, praise the Lord. Everyone that we have interviewed pretty well knows where they got it. A large majority of them have traveled. A couple of them have traveled to the extent that they counted as our case, but they've never been in Christian County. So that's kind of how we have come to that decision. Like I say, I hate to say, oh, well, Ozark's got this many cases or Sparta has this many cases. It makes that town look like for some reason they are not following social distancing and things like that. And that's not been the case with what we have. Now, if we should happen to see that, okay, we have a cluster of cases and it's located here, then you better believe it. We're going to be out there letting people know this is what's going on. This is what we need to avoid, and this is how we're taking care of it.
Bruce, last question.
Yeah. Bruce? Go ahead,
Yes,
Bruce.
I have a question that just kind of relates to guidance statewide. It occurs to me that the needs of of the different regions of the state are different. St. Louis and Kansas City's need for certain kinds of guidelines might be different from the Springfield metro area. Does at the state level, at state leadership level, is there any guidance that's given that just applies to particular regions? In other words, we think in the state of Missouri that Springfield metro area ought to consider these kinds of guidelines in addition to what the governor set out, or is it simply just left to the political subdivisions to figure it out on their own?
At this point, it has been left to the political subdivisions to figure it out on their own, per se. In Southwest region, I know that we are on conference calls frequently with the other health departments in our region, and also, of course, with our county and city leaders. And it's kind of come to the point that everyone is in agreement that Springfield Green has the most resources, they have the most personnel, and so they've been identified as that they're going to be the lead. Yet what they do, we all do together as best as we possibly can. Now, I know that there are things that we can't do exactly like they do. For example, your orders will probably come out a little bit different than what theirs are, but I'm sure you guys will be reviewing back and forth to see kind of what Southwest region is going to go with. And, you know, a lot of that is just continuity. It's so that our people know what to do. It's so they're not county hopping. You know, well, I can't get my hair cut here, but I can get it over there. And so let's all go there. And that has happened with some of our counties that have been more lenient. They have had an influx of things they didn't necessarily want. But as far as the state telling us what to do, they do not. They're available for questions or whatnot if we should happen to call them. But, you know, as far as saying you need to be doing this because you have 20 cases in Christian County, they don't. I don't think they have the personnel to do it. And it's also everybody's cases are different. Like ours are not community spread. Another county, it might be. So the guidance would be totally different. I do think they're getting a lot more involved when they have cases that involve the long-term care facilities, or obviously in St. Louis where they have a really large problem right now.
Follow up?
Please.
I've noticed countrywide and even as close by as Branson, communities have been setting up panels or what they call task forces made up of leaders from business, health, government, to come up with guidelines for the loosening or the opening up. Have you heard anything statewide as to how common these kinds of task forces are? Is Branson an anomaly, or is this even recommended?
I have not heard statewide. I do know that Branson works together collaboratively with their partners frequently. They do have a hospital there, which is where a lot of their input comes from. We have noticed that the lack of a hospital in our county kind of lets us out on several things as far as being able to do some of that particular kind of collaboration. I do feel like that a lot of the conference calls that we've all been involved in has been a task force to a certain extent, you know, because we have people coming from all different sectors, and with that, then we get a lot of opinions. We know how the schools feel. We know how the cities feel, how the county feels, first responders. I mean, all of those people are at the table, but obviously right now we can't have a table.
Okay, that's all my questions.
Oh, go ahead, Bruce.
That's it.
Okay, Ted?
Thank you. From a medical perspective,
is there a reason from a medical perspective for Christian County not to do just what the governor has suggested? Is there a reason that we should be more restrictive than what the governor has suggested is what I'm asking from a medical standpoint of view?
Okay, Karen, are you on the line? Karen? Is she muted? Or does anyone know if she's on the line? She was going to be there.
There are two phones that are muted. I just don't know what her phone number is. We'll unmute them.
Okay.
Karen, are you on the line? Karen, are you on the line?
Yes, I'm here.
Okay.
Yes,
There
this
she
is
is.
Karen.
Hi, Karen. Would you mind to field that question? Karen has her doctorate in nursing practice, and she is obviously a much better expert on the medical end of things than I am. I'm definitely stronger on admin as far as my personal experience. So Karen, can you take that question?
Well, I'm going to try my best. Bear with me again. I'm very new at coming into the COVID in midstream, but my concern moving forward with the medical side is, if we see a lot of cases that start to develop after we start opening businesses up, it's going to be very hard to control at that point. So I know people have comfort right now thinking that we don't have a whole lot of cases, but I do think that stay-at-home order has worked. And we've seen proof of that just because the number of cases that we've seen over the last couple of weeks have really decreased. So we are opening ourselves up for high risk of seeing more cases as we open up, as the governor has plans to do. At minimum, we have to cover all of the guidance that he's given us whenever we do open up. But as far as the cities and the county, we can do more stringent activities if we feel that that's necessary. So what we're going to have to depend on is our community working with us to take their part as well and keep our communities safe, not only themselves, but our neighbors. So once we do open up, we have to make sure that those individuals that are working out in the community or the employers have what they need, which unfortunately, I'm not certain at this point as far as the supplies that they need for masks or hand washing supplies or hand sanitizers, those kind of things. So again, I'm not really sure what the employers have available at this point to open up. I know we can use masks at this point that are homemade if necessary. Again, I don't know what each employer is thinking. I know Walmart has already started their employees, asked them to wear masks while they're working, they're taking temperatures, things like that. So I think we're going to have to continue with those steps for quite a while until we can see loosening these restrictions, what's going to happen at that point. It may take 2 or 3 weeks after we start opening up to see how many cases that we have. And at that point, we're going to have to reevaluate and see, if we're not seeing a lot of cases, then that's great. Then maybe we can loosen up the restrictions a little bit more. But we have to remember that we're really close to Branson and to Greene County. Well, at this point, the Taney County doesn't have a whole lot of cases. They actually, I think, have fewer than us. Greene County, I believe, is only 5 or 6 miles up the road. And we have a lot of individuals that commute there as well. So even though we're trying to control things in our own county, we're going to be impacting other counties as well, and they're going to be impacting us by what they're doing. So I don't know that I'm really answering your question straight on, but there's still a lot of unknowns as to what kind of supplies are out there and, what do we really need to do? I don't know that we have that answer at this moment. We really need to wait and see too what Greene County is doing. I don't necessarily agree that we need to do everything that they're doing, but in order to stay consistent among our neighboring counties as well, I almost feel like we need to do maybe a little more than what the governor's order is guiding us to do. But again, we're not going to know until we get a starting point and just try to move forward from there. If we open up like the governor would like to, it's going to be very hard to go back and try to get control over this again. So we've been told if we have more cases that we should have extra help coming from the Department of Health and Senior Services as well if we need that, because we do have limited staff over at the health department to work these cases. But we do have some backup individuals that are going to come out and help us if we do start seeing more cases. And once we exhaust those resources, we're going to move on and ask the Department of Health for their resources. So I hope we don't come to that, but I do think that we're going to be at a high risk right now as we open up, because everybody's been at home and everybody's going to get out right away. So I would like to see us go at a steady pace, see what happens over 2 or 3 weeks for our cases, and then continue to loosen up those guidelines. But I'm willing to work with the county and city leaders to see what your opinions are and thoughts are on that as well.
Karen, would you mind to elaborate a little bit on COVID itself and the mode of transmission? And is this more contagious than other things we see? Can you hit that from that perspective?
It's really hard to say just because with COVID, there's still a lot of unknowns. So I want to make sure everybody does know we have a lot of individuals out there that do not have symptoms, but they potentially already have COVID. And we don't know because they don't have symptoms. So that's why they're doing some of these point in time testing that you're seeing in Taney County. And so that's going to give us a better indication of, you know, how many people do we have out there that we didn't even know that had it, that's already had it, or that are sick now. So, you know, we deal with tuberculosis on a much lower scale than this. And the disease investigation portion of it is very similar because we quarantine those patients as well. TB is highly contagious. So as far as comparing that to TB, I would say it's not as severe as that, obviously, but it could be for a certain population. So you have the immunocompromised individuals out there, the elderly. So it just depends on the patient. And as we've seen, and we've even had some younger individuals that have ended up with COVID that are on ventilators. So it's just hard to know. And I don't even think CDC knows at this point all of the ways that it's spread, all of the symptoms. I think everybody probably read that they've opened up 6 more symptoms, which I'd have to find my paperwork to see what all those are besides the fever and the cough. But they're adding symptoms as they're finding out and doing more investigations. So again, there's just a lot of unknowns at this point that we're having to work through and make changes as we learn those as well, which that's pretty typical for a new disease that we've never really worked with before.
Jason's got a.
Yeah, Jason.
What's the recovery rate?
Cindy, have you read?
Are you talking about for Christian County in general?
In general.
Okay. For Christian County, then what we're running into now is there's a lot of argument as far as what recovery rate really means. Some people are using CDC's definition of recovery, which means that they would have been at least 7 days out from symptom onset, fever-free without fever-reducing medication for 3 days, and no symptoms. But what we are finding also, and this is where the argument comes in, is that several of our people who meet all of CDC's guidelines are still testing positive for COVID. Now, as to if they are still contagious or not, then like Karen said, there's a lot of unknowns. They're trying to figure that out. But as far as Christian County, we have 14 people who meet CDC's guidelines for being considered recovered. But of those 14 people, I know we've still got 3 or 4 that have tested multiple times and continue to test positive even though they feel okay.
I'm talking more about not dying. So is the mortality rate 2% or less and the recovery rate 98% more?
Karen, can you get that one? Because I'm not sure on that stat. I believe it's less than 2%, but I could not guarantee that.
I'm sorry, I don't have an exact number on that. I know the governor had addressed that somewhere in as far as what he had told. I could not quote that exact number.
But when I hear that we're talking about being more restrictive than the state, it seems to be that the argument would be because of what we don't know, not because of what we do know.
Yes, I would agree with that at this point, because we don't know what's going to happen moving forward. Once we
But
do
I have
open everything up.
constituents, I have business owners who are losing their livelihoods. And it's hard for me to tell them that you have to keep your doors closed and you got to risk all you've worked for because of things I don't know.
Right. That's why we're hoping to get everything opened up to some extent starting Monday
Yes.
on May the 4th, and then move forward from there, like I said, until we see how this is going to pan out as far as these baby steps, should we call them. And, you know, it's not going to be an instant thing, because we're not going to know until we get more people out there how many cases that we're going to have. And there's really not going to be much turning back at that point, because people are not going to want to close their businesses again. So
people didn't want to close their businesses the first time, you know, but
exactly
what I see is that the levels are flat or going down, at least for Christian County. And what I see is a vocal uprising and disagreement amongst constituents because they're being forced to stay home and they're being denied an opportunity to make a living. I know that there are government benefits that are being passed out, you know, additional unemployment, the stimulus checks, but that adds to an ever-growing federal debt. You know, there's just a lot of factors that the board here have to consider as to, and the mayor, as to what we're going to do in the future. And I would like to I'd rather do it on what information we have, rather than a fear of what we don't know. I may be the minority, but I do appreciate you coming and answering these questions. I mean, I'm certainly not trying to be harsh. It's just more, being a lawyer, I kind of just want to know what the facts are and what we can show and what we can prove. So it makes it easier for me to explain things to my constituents.
Yeah, and it is going to be hard moving forward, because Greene County, I think, has had 8 deaths. We have not had any deaths that I'm aware of in Christian County, unless Cindy knows about that, but that could change at any point as well. It would just take getting COVID-19 in one of our nursing homes as well, which I know the governor's wanting to keep those restrictions a little tighter. So I definitely understand the concerns of the businesses. If I had a business, I would feel exactly like them, but they also need to take the consideration of the health of the community too. So if they can do their part in protecting the community, and the community is okay or feels comfortable going to their establishments, we're going to be able to open up a little more, you know, after we get these initial numbers, just to see how are these baby steps working for the first 2 or 3 weeks. So if we're not seeing any cases in Christian County, it's a potential we can open up a little sooner and a little more. But it's, to some extent, everybody should be able to open up at least Monday, May the 4th, and take precautions, do their part, and hopefully keep everybody safe. I mean, they have to understand too, if we have a business open and they're not comfortable going there, then don't go there. Or if the business isn't comfortable opening up because they don't want the liability, because there is liability to each business as well once we open up. And I hope that they understand that. If somebody gets ill and dies, you know, related to their organization or facility, it's probably going to come back on them. It's not going to be the state or the local governments or health department. We've given guidance, but did they follow that? So again, it's going to be something that we've got to think long and hard about and make sure everybody understands. And we can't just open up and nobody follow any rules at this point, but we can open up and everybody try to do their best to keep everybody safe, whether that be wear masks, use hand sanitizers, stagger shifts, those the kind of things. So I do think they can all get back to work. And then as we keep moving forward, then we can open up things a little better.
If I could interject just a little bit there to add to that. Also, I think that as far as the health department goes, we feel like there are mitigations that can be taken in order to make this a much safer opening, because we do understand completely that we want to have a community to go back to when we do open up. But some of the biggest concerns that I have heard and that I feel myself are for the mass gathering situations, because that is the ones that is very, very hard to control. You know, for example, I know Karen's planning to open our office soon. She will have people in the parking lot coming in one at a time. We'll have probably masks or whatnot. But when we get out at a large event, and we love our large events, I am huge on attending, helping, whatnot. You know, I want to see the duck race go on. But we're going to have to figure out something with those large events if you guys are going to still allow them to happen. I think we're going to have to figure out a way to control those events rather than to just say, now when you get over there, make sure you're 6 feet away from everyone else, because human nature, that's probably not going to happen, especially for a lot of people who have been allowed to see each other for several weeks now.
This is Rick Gardner. Let me just put a kind of a point of order in here. We have two people that we want to hear from, Karen and Cindy, that are on telephone, and they cannot see who is speaking, nor can they see who holds up their hand to speak next. So we've kind of got to defer to them whenever they want to speak. They will just kind of clear their throat or say something. But on the case of the aldermen that are on the call, if you would please identify yourself. Cindy, the last person that was talking with you was the attorney, is Jason Schaefer, one of the aldermen. And so alderman, whenever you speak, if you would please say who you are if we're speaking to the health department officials, because they can't see the screens. So enough of that. The other thing, Ted, I see your hand, but before you say anything, let me just throw out here. Yesterday was a real zoo around City Hall. We do not feel like we have to do everything that Springfield and Greene County says. I think we feel we have to certainly do what the governor orders as a minimum. But we have ideas being thrown at us from all directions, from the county, from the city of Nixa. And not that we're going to follow Nixa because they are Nixa, no more than they're going to follow us because we're Ozark. But we've always decided, or from the beginning, that there's some semblance of unity in this, and that is not necessarily being just like Springfield. Now, it has been, in the first part of this, we did that. They had more resources. They do, they were kind of the guiding light in this. Well, we have been practically untouched by this, but we don't want to get arrogant about that. So today is a day that we're going to come up with an order, and I suspect it will be as flexible as we could possibly make it. But we're not there yet, because as late as 5:20 last night, we had input from the city of Texas saying we should do this or we should do that. And at some point, we just have to go home and rest and come back the next day. So we'll be in touch with them today and with the county, but we're probably very close to coming out with an order that I just hope will be okay with everybody. It will be as flexible as we possibly can. Churches are still going to be, they're going to be the tough nut to crack. And not that they haven't been compliant, because they've basically all been shut down. I think all but maybe, well, there was one that threatened to open last weekend. I don't know if they actually did or not. But that's kind of where we are. And Ted, I agree with your position, but we're not where we have that decision yet. So, but we should have that, hopefully, Stephen should think by the end of the day, by the end of the day, hopefully mid-afternoon, but we'll have to get our heads together after this meeting. That's the plan. And then get together with Amanda, who will have to draft something. And hopefully by the end of the day, it'll be something that everybody can live with. But we agree that we want to be as flexible and as open as possible within reasonable constraints. But we have had some of the businesses that have been hurt the most coming to us and bringing us plans to reopen. I mean, very strict plans that they say, if you'll just let us open, we will do this, this, and this. And most of them are stricter than anything we've seen. And so that's probably what we'll let them do, but we're not there yet. So I'm done. Ted? Go ahead, Ted.
Sorry about that. Hey, this is Ted Smith. I've got probably a couple of questions for you. One, and I appreciate that I understand the medical and the political sides. It's a difficult position at times, and obviously COVID has to a certain extent shown that. But with that said, I'm kind of at the point personally that I want to know, and I know I asked this before, and I know you answered it as best you could, and I'm not asking you to re-answer it, but I want to know the medical data that tells me why I should not do exactly what the governor says. And I don't see that, and I don't know it. Kind of going with Alderman Schaefer, I want to know what the data is that tells me I should not do exactly what the governor says. Why should I disagree with him? And I'm not sure at this point I have data that tells me I should. But with that said, there's a couple of questions I have. Is there anything, I read the order, but I didn't go back and read the CDC and so forth. And there was some of the order that I just didn't quite understand at all what it was even meant. But with that said, is there any guidance under his order for individuals to wear masks or business people who go back to work to wear a mask? And then the second follow-up question is, you referred to baby steps, and I think his order is anything but baby steps, but in your view, just quickly, maybe what's a couple examples of maybe a couple of little baby steps from your perspective?
Ted,
This is Karen.
That's aimed at the health department, correct?
Yes, sir.
Cindy, Karen, go ahead.
Yes. Go ahead, Karen, on that one. You mentioned baby steps. What did you have in mind with that?
Yeah, it's similar to like a reversal of what we started as. You know, we had the high number of, okay, we can have this many people at gatherings, and then that number just dwindled down to, I think we finally got to 10. So kind of going in the reverse steps there, just to kind of ease our way back in. So that's kind of the baby steps that I'm referring to, because we kind of took that way, getting to the point that we're at, maybe a little bit more rapid pace, just because we were seeing cases. Hopefully we can speed that up going back to whatever our new normal is going to be. But at this point, again, not just letting everybody be a free for all, but putting those guidelines back in place kind of the way that we took those things away. Does that make sense?
Yeah, yes, that does. Thank you.
Mm-hmm.
And then the first one, actually, I'm probably covered up. Is there any requirement under the CDC and or Governor Parsons' order for individuals to wear masks?
The CDC recommends masks. There is no requirement for masks. Governor Parsons, the last time I heard him mention masks in his talks, he was very much that it's up to the individual. He said he did not plan to wear a mask himself.
Yeah, or the business. I know, because he brought up the legal liability if somebody were to get sick at the establishment. It's related to that. So again, it was just more of a comfort measure for the community, knowing that they're safe going into the establishment. So they feel like it's maybe just something that each employer should think about, so that people want to come there and that they are feeling safe, and that nobody's feeling like they're at high risk of getting sick if they're getting out.
The other thing I think is important to note on this. Oh. Go ahead.
Go ahead, Cindy.
Sorry. Go ahead, Cindy or Karen, whoever was speaking. See, the problem is you can't see when somebody here holds their hand up, so you all go ahead. No,
yeah.
Go ahead.
What I was going to say is, I think something that's notable as far as the masks go is that when I have been out, I have seen a large number of the fabric masks. And that's simply because people can't get their hands on the others. But everything I read on that says that that is better than nothing, but that's about it. I mean, it's definitely not full protection. And so, you know, as far as the businesses, what they are going to do once PPE is more available, and I do believe it's getting more available. I'm not sure there's not some price gouging going on there. I know we have a local businessman there in Ozark who purchases a lot of it, and we've been trying to possibly partner with him on that, but he says the prices are still extremely high compared to what he would normally pay for it.
Go ahead, Steve.
Yeah, Ted, I wanted to just let you know, there are some guidelines from the CDC as well as the governor's order. I will send to everyone, if you don't already have it, 2 documents. It is the actual governor's order, but it's also the Show Me Strong Recovery Plan phased questions and frequently asked questions. Are very helpful. So we'll get those documents out to you after this meeting. And one thing that we're looking at in our order is that there was a new definition that was created called personal and medical care services. And so anybody that provides a service that is difficult to remain 6 feet away from somebody, that's where we're recommending or saying that, we're not recommending that that would be part of our order, that that person would need to wear a mask. Now, we've talked about gloves, and gloves become a whole different situation. It can be difficult. So in the personal and medical care area, that's probably where the masks are going to be required. But on an individual basis of just people going in and out of their house, there won't be any requirement for masks. That'll be left up to the individual to make that decision. But I'll send you these documents. It'll be helpful.
Any other questions from, Nathan? Go ahead.
Yeah, this is Nathan Poston. I have Ms. Blue, Ms. Peak. I've got several questions. One, not counting private labs, which you probably don't have an answer for. Are you aware? Have we been testing people in Christian County that are asymptomatic?
We do have one lab in Christian County that will test asymptomatic. It's at that, I believe it's called Ozark Family Valley Medical Clinic. It's up there by CC. I've spoken with the physician there, and she says if someone comes in and says, I have a slight headache, then I will test. The thing that I don't believe they do is file insurance. And so to do that, then there's close to a $300 price tag on it. But she will do it.
My real question
if you're referring to the, I'm sorry. If you're referring to the point in time testing, I'm not aware of us being chosen for that. I think that may be something that came through the Department of Health, and they've chose sites throughout the state to try to do those. Is that what you're referring to?
It is. And also, can you follow that up with, do you have a total number of known tests done in Christian County?
No,
I would
we
say
do not.
we do not, right? Because we're not even getting lab results for negative. So I don't think anybody's going to be able to ever give us that number. Is that what you would agree, Cindy?
Right. I have requested that number on multiple occasions, and there for a while we were even sending out press releases on the number of negatives that we had. And then at one point, we got correspondence from the state of Missouri that said that they would no longer be sending us any negative test results because that wasn't a good sound number to go off of, as far as people were trying to do percentages, as to we've had this many positive and this many negative, but they knew that there were many, many more negatives than what they were getting. The private labs just don't send them negatives at all.
Okay.
Plus we have people being retested as well, so we may get 3 or 4 retests on those individuals. Again, we don't typically get anything on everybody, so I don't know if it's a glitch in the system. I don't know if there was just being overwhelmed by the testing sites maybe that are reporting those. I'm not certain as to why they're not sending those out, but it's not just a Christian County thing, it's statewide.
Right.
Okay, so as we open up, I think it seems pretty safe to say that as we open up, cases will increase. We have no idea what that number is going to be yet, but there will be some sort of increase just as people move. And the most effective way I've seen to combat this so far, outside of full-on lockdowns is widespread testing combined with contact tracing. And I've seen the governor mention that, and I've seen that mentioned by the CDC and at the federal level. At our level, at the local level, are you convinced that that enough testing exists to do that? And if we get into contact tracing, whose responsibility is that?
Well, the contact tracing starts with the local health department. And as Karen said, we do have, I believe I've got access now to 7 experienced epidemiologists. We have 3 on staff, and then of course Karen also, and then we have 4 other on reserve that when we call, they come in and can help us with that. And that is a really good number of people to have available for our county. Also, we are in an agreement regionally to share EPIs as cases go up, unless everyone is overwhelmed. Then, if Taney County ends up with, let's say a food service establishment that there's an outbreak associated with it or something like that, then we can send ours down there or vice versa. When we run out of that, the state is also hiring several people to be available to loan out, you would say, to counties and work cooperatively with them. And then I have not had this experience, but I know Karen had mentioned to me yesterday that she has actually worked with teams coming down from the CDC to help also.
Okay, and then one last question. I was reading an article this morning about New York, and New York was talking about their reopening plan, and they are implementing what they're calling circuit breakers. So if the new cases rise too far, too fast, they lock it back down. And their circuit breakers was hospitals at 70% capacity, or their current transmission rate is a 0.8. If that goes to 1.1, that was the 2 circuit breakers they put in place. Do you have, I'm putting you on the spot here, I know. Do you have any sort of metric like that you would recommend to us that as we open up, if X happens, then we need to slow down or go backwards?
Well, I have had concerns about that particular thing. We don't have a metric in place, but part of the reason for that is we are going to see increased numbers, and a lot of people are going to think that that is because we opened up, particularly those who are, extremely cautious of the disease. I think it is unfortunate that the opening up period is coming at the same time that additional testing is coming up. At one time you had to be hospitalized in order to get a test. After that, it got to where you had to have the 4 symptoms that CDC had thrown out there. And now the physicians are being told that even to use the state lab, they're loosening up a little bit on what criteria they're using for testing, because they're finding out that a lot of these folks don't have all of those symptoms. And so with additional testing, we're going to get a larger number of positives, even if we don't open up. It's just a lot more people can be tested now. There's a lot more tests available, and the criteria has been lessened. So to me, that makes that a really hard thing to try to figure out where you're going to use a cutoff number, because are your numbers up because people are circulating, or are they up because you have so many tests out there now and you don't know how many negatives you've got? Again,
so
that is such a frustrating thing for us.
As an alderman, then, what would you advise me that I should be concerned about? Hospitalization rate? I mean, if you don't have a specific number, which category of metrics, I guess, should I be concerned about? Hospitalizations? If infection rates aren't perhaps that big of a deal because you can be asymptomatic, is hospitalization more important or something?
Well, I think that would obviously be, a consideration. If we were starting to see a lot more cases and a large percentage of our positives, had very severe symptoms. Like right now we have, I believe we still have 2 people on ventilators out of the 20 cases that we have, so those rates are already fairly high, but it depends on who gets it and what their existing chronic conditions were. That probably doesn't answer your question. Karen, can you give him something a little better on that as far as what he needs to look at?
Again, it's hard because we don't have the hospital here. I mean, we can track those cases in Christian County to see who was hospitalized, but I kind of agree with you. There's really no magic number. So we have 20 now. So again, in 2 or 3 weeks after we open up, let's see what we've got. If we double that, then obviously, again, we need to look back and see, were these individuals tested because they just wanted to be, and they were symptomatic, or are they tested and because they were sick and needed to be hospitalized? So again, it's just because we have so many new things coming out every day and ways to test and places to test. And it's hard to say at this point because everything will probably change, next week even. So it's just really hard to put a number on that, again, because we've got a lot of factors going into that. So, I mean, we could have it in a nursing home and then that, maybe we have 40 cases there. So that looks like a very large increase for the county, but whenever you look at it, it's probably, more of a cluster. So that's not really community spread at that point. It's not spread throughout the community to different counties. So we're just going to have to look at the data as we get it in and see what kind of testing we get back, the numbers that we start seeing. Best case scenario, we're hoping maybe the majority of the people have already been exposed, but we're not going to know that until we start making these steps forward and just keep moving forward as we can with the data that we have.
Okay. Ladies, I thank both of you very much. And Mr. Mayor, if you want my 2 cents, I'm honestly not that concerned at the moment. I'm more concerned about what happens next, because I think they're absolutely right. Cases will rise with testing. Cases will rise with opening. And I think how we respond to that increase and when we say that's too high, we need to lock back down, is probably more important than what we do right now, because it's going to take that movement of people to make this a big issue again.
Okay, I want to take a little bit of a poll here in a minute, but Alderman Flores has a comment to make, so why don't you go ahead, RJ?
Well, the only thing I was going to say is earlier when you were talking about Lowe's and Walmart and things like that, and we were talking about how hard it is to spread places like that. So even though we've kept them open and people are going in and out of them every day and they're packed, probably because there's nothing else to do, we haven't really seen necessarily a rise in cases. And Walmart's been open, grocery stores been open. Of course, there's responsibility with that. People are keeping their distance. The employees, on the most part, have masks on and things like that. I guess the question is there really much of a difference whether it's a Lowe's or it's any other type of business, as long as people are taking the personal responsibility that they have been? It's hard to look at one business and say, well, you can do whatever you can have all these people come in every day, and then look at another business that's a little bit different and say, but you can't. And so I think that, if we're being able to get to that point and having that responsibility where everybody knows, you keep your distance, you do the same practices that Lowe's has been doing, that Walmart's been doing, we've been able to do this thus far, it feels like we should be able to make that a little more widespread for everybody. And that was really my thought.
Okay, we need to, well, I'm not in any hurry to end the conversation, but it seems like we beat this around a lot. And what I would like to do is to have every one of the 6 aldermen just very briefly, don't go into a long speech, I guess, but I'd like a very brief idea of where you feel we should go from here, whether we should be very loose in our opening, whether we should be strict or somewhere in between and try to open up and watch the numbers as they may change. So we're going to make a decision today, and the reason we do that, we can wait to the last minute and say, oh, well, we wanted to hear what everybody else is doing. But we want to do what's best for Ozark, and we want to let the businesses that can be more open know as soon as possible what they can do so they can prepare. So
Bruce has his hand up.
Okay, yeah, I'm looking at the screen. Bruce, where is Bruce?
Well, Bruce moved his camera.
Oh,
There he is.
Bruce, I can see
Yeah,
your.
my camera,
Okay.
my
yes.
camera and my
There you go.
automatic, and if I don't move around, it keeps thinking on the computer.
Oh, okay. All right, Bruce.
Okay, the comment, well, first of all, my position would be that as far as various industries that the governor has indicated he wants opened up, I would agree that those industries should be opened up. But I think there is something that we should all consider, and that is consumer confidence when opening these industries up. I don't think we should make the assumption that just because a restaurant opens up, that people will flock to it, or that a hair salon opens up, that people will flock to it. I think that the public would need to have confidence that when they go and do their hair or go to the gym, go to a restaurant, that they don't end up killing grandma and grandpa. And if that sounds overstated, I'll just point out that the Great Depression was not caused by the stock market crash. It was just caused by financial institutions and consumers not having confidence that the economy would do well. And also, I would caution that if there isn't at least education and guidelines for those businesses that have close personal contact with consumers, which is restaurants, hair salons, and the like, then there could be a backlash, a consumer backlash. And that would be very damaging and long-lasting, cause long-lasting damage to an economy if consumers just don't feel safe, and that's because they're walking into places that aren't deemed safe. I had messaged different kinds of guidelines and mandates that are under discussion in a heavily, or in a county in Florida where there's a great deal of restaurants and entertainment venues. Not from the point of view of requesting that mandates be set up, but from the point of view that at the very least, there be some sort of educational campaign, perhaps work with the county, really probably work with the county, that talks to restaurants about having sanitizers on their tables, each table, that talks to, or that speaks about employees, even hair salons being required to have face masks, that talks about supervisors looking at employees that have flu-like symptoms and asking them to leave, talk about wiping door handles, talk about bartenders hand sanitizing after each drink served. These are not things that I've thought of. These are things that are being considered by industry leaders elsewhere in a county that in another state that's opening up, Florida, and they're very much worried about consumer confidence. So I guess my position would be, yes, let's open up those industries as the governor has suggested, but at the very least, provide resources for businesses so that they may have the information to operate obviously safely, so that people can have confidence that by going into their institutions, they themselves aren't going to get sick or have a loved one get sick. So those are my 2 cents.
Okay, let me, before anybody else speaks, let me tell you what staff is already working on, Bruce. It's very much along these lines. Brooke and Sam are working on a pamphlet. Maybe a booklet is more likely. It would be more extensive than a flyer, but a kind of a guidebook for how to use PPE, how to sanitize, and something in detail for some of these businesses to look at and say, well, what do I need to do? And so we're looking at providing that. That's already in the works. It's not done yet, but that is something we hope to be able to provide. That's something that Steve happened to find online, and well, actually found several of them. Maybe one of them was from Florida, but there was one from Alabama in Tuscaloosa that was just incredible. And we're going to do a little R&D, rip off and duplicate, and come up. I mean, not that we're going to copy their booklet, but we're going to do what you suggested. We're going to have guidelines for them that they can look at and refer to. So that is definitely in the plan for, and that's why we want to make this decision as soon as possible, so we can get that done and get it to people. So, Steve, do you have any comments on that?
Just that, yeah, we have reformatted it. It's a great document. It's a good source, and we're ready to put it together and finish it today. But we can only finish it once we know what our order is going to say, because we need it to be consistent with whatever our order is that we're putting out. So that's why this is great timing, because we're trying to get this wrapped up today so that we can communicate to our public and to our businesses where we're going. So, yeah.
Okay, let's just go around the screen. We've heard from Bruce, and the consensus there is the governor's minimum is what we should do, and at a minimum. So who wants to go next and chime in? Ted, Nathan, Jason, Nathan, you got your hand up.
Yeah, I'm sorry. I've got to actually run in a minute, so I'll just go ahead and go if that's okay. I'm really just going to echo what I said earlier, which is I don't see a difference between essential and non-essential businesses. There are some businesses, barbers and masseuses, that require such close contact that I don't know how you do them safely, but if somebody's got an idea, I'm certainly willing to hear it. I do think you need some group restrictions. I don't know what that is. The 10, the 20, the 50, maybe the health department would let weigh in on what an appropriate restriction is, but I'm certainly in favor of some sort of group size restrictions. And I think we need a contingency plan for what happens when the cases goes up. What is too high? What is too fast? What is too high? Too many hospital beds full? And how do we pull back when we hit that number? I think that's something that needs to be worked on as well.
Okay, good point. All right, Ted, what's your thoughts?
Yes, sir. I think at this point, I mean, to me, May the 4th is an arbitrary date. We should just go with the guidelines that the governor has put out. We shouldn't do anything more at this point, because regardless if it's May the 4th, if it's June the 4th or July the 4th, until we kill this thing, there will be a round 2. And that's what we need to be focused on. And in the meantime, I agree with Nathan. There is no difference between essential and non-essential. And I think we will look back on this in history and say that was a mistake, that we picked winners and losers, we being the country, not us personally, that we should not treat businesses different. And we should not be in the business of picking who's going to lose and who's going to lose their business and who's going to go out of business. We shouldn't be in that business. That we need to do what the governor says. We need to get ready for round 2. That is where I've said before, 100% of our time needs to be spent on. This opening is not something we should spend our time on, in my opinion, because again, until we kill it, there will always be a round 2, and round 2 is going to be worse. So we need to be focusing there. So I say at this point, the governor's put out guidance. We don't need to do anything different, unless there again is medical data that tells me differently. And at this point, I haven't heard it. I no disrespect to the health department. I think you've answered them very appropriately, but I do not have medical data that tells me that opening May the 4th is any different than opening June the 4th. So at this point, let's just open and be done with it, and let's prepare for round number 2.
Okay, Heather, what are your comments?
I agree with Ted and Nathan. I think we should follow the governor's guidelines and open up, let non-essential and essential businesses open. I like the idea of the pamphlet. I think that's great. How would we get that pamphlet to all the businesses? How would that work?
Well,
It'll be done digital.
Yeah.
We'll give it to the chamber. We'll give it to the Chamber of Commerce and to our other partners that are out there, just like us, and we'll share that everywhere we possibly can. Our staff will have it, because when we do follow the governor's orders, you have to remember that the governor, he didn't put a lot of restrictions on, but there is one restriction in his order, and that does set, just as his previous order, those businesses that are under 10,000 square feet and those businesses that are over 10,000 square feet. So that never changed. That's the same. So we'll be, if we're following his order, we'll be using that equation. And so we will be making contact with our businesses through our code enforcement department, as well as our fire district. So that's how we'll get it out.
Hey, Steve, real quick on that
Okay,
one.
thank you.
I'm sorry, Heather, I didn't mean to interrupt you. Steve, real quick on that one. Do we have any businesses? I mean, I think if I remember right, the way the order was written on the size restrictions was retail sales. Do we have any businesses in Ozark that would otherwise be impacted by that if they are outside of retail sales?
Well, that was a conversation we had all day yesterday, and the way the governor has kind of put it, it goes back to something Mr. Poston said, where he didn't really distinguish between essential and non-essential businesses anymore. It's kind of more grouped in together. So you really have, look, almost everything's sort of a retail sales, retail service, whatever, even retail restaurants. And so we're going to, what our thought is, the best way to do that is to just put everybody that is not otherwise in the personal or medical services section, you know, where I'm literally 2 inches from you. We're going to put that under that same category so that it's just easy for everyone to understand. Here's your square footage. Here's how you divide it. And Ted, you know, other than the big boxes and the big stores, you know, I'd say probably 80%, if not more, of the businesses will be under 10,000 square feet. So you're looking at probably their square feet times 25% of their capacity. Now, when you get into the bigger ones, it's anything over 10,000 is 10% of your capacity. So anyway, I hope that answers your question. Yeah.
Jason?
Follow the governor's order.
All right, RJ?
I'd say follow the governor's order, and I do think that the public, kind of like what Bruce was saying about confidence, I think that some people will probably go above that personally, just because they want to stay safe, and I think people will be responsible about it on the most part.
Okay, then that's pretty much unanimous. Yeah, Nathan?
Sorry, I have one quick question for Ms. Calloway. If a business wanted to put a sign on their door that says mask required, can they do that?
I would think that they could, yes.
Okay, that's not a infringement on anything. They can require that for entry into their store to patronize their business?
As long as it's not related to some sort of discriminatory behavior based on a protected class, I think that they would be free from any sort of repercussions. But, you know, I'm not, there's nothing I can think of that would.
Well, there is one business locally that has kind of thrown up a red flag on requiring it, but they've come up with a solution. Randy Mitchum said, for security purposes, I'm not going to let anybody in that has a mask on when they come in. They can put one on, or if they do come in, there will be somebody at the door that asks them to remove it long enough or pull it down long enough that their security cameras can catch their full face. And so for security reasons, that there will be people, but all of the personal service stuff. I talked to a beauty shop, 2 of them are hair salons, and it's going to be kind of hard for them to do what they do if somebody's got a mask on. But some of them may require them to put on for as much as they can, and then move it. Or, you know, so I think they're the ones that I've talked to are wanting people to wear masks, because they're working on it. They want to be protected from the people. So, all right, we've got the consensus on that, so we will move forward, and the consensus is that we will stick to no more than the government or the governor's orders. So how we fine tune that, I don't know, but we'll have that done today. So are you ready for the next agenda item?
Yes, absolutely. I am going to say thank you to everybody. Cindy, Karen, thank you so much for being on here. I definitely would like to call you guys after the meeting and visit with you a little bit more about our order, just so that you know exactly what we're going to do, if that's all right.
Yes, we would appreciate that because we get calls before the order. We're already taking calls, with the governor's order. And so far we're telling people, well, we have to wait and see what our local orders will be. So when we have one, then it's really important that we know so that we can communicate the message that you all want to get out there.
Yeah, and I know that the Jimmy Lyles of the city administrator and Nick's also wants to be on that. So we'll probably just give you a conference call or something so we can all be on the same page, okay?
Okay, that'll work out. I think the local health departments have got a conference call at 2:00. I'm not local, the regional. So if you could avoid that time, it would be good. Also, one thing I wanted to throw in there when you guys are talking about educating your businesses, several of your businesses are food service establishments, and we will be taking care of that also. We went around when it first started and did lots and lots of personal interaction, and then what we couldn't get to, we did phone calls. And so with everything opening up, then we will definitely be giving them guidance on, best practices.
Sounds good. Okay, Karen, this is Rick Gardner, the mayor. I want to tell you, I look forward to meeting you. And Cindy, I've known you for a very long time, and I wish you the very best in your retirement. So, and I understand that takes place tomorrow night when you walk out the door.
What did you say? I'm sorry. I missed the last part.
I wish you the very best in your retirement. Is it my understanding that that is effective tomorrow?
Yes. I'll be there tomorrow, and then, Friday's first day. We'll see.
All right. Sleep late and keep your phone close.
All right. Thank you.
Thank you all.
Okay.
All right.
Oh, Ted, yeah.
You're muted, Ted.
Yeah, no. I was just going to say thank you to the health department too. I really appreciate it. I appreciate all your assistance and all your help in answering all our questions. I just wanted to say I really appreciate it too. So thank you.
You're very welcome. And we do want to, I say this even though I'm going to be gone, but Steve has my number too, so I would help Karen with it. But we would welcome questions. It's so much easier to be able to address things head on so that people know the whys of what we do. Then, thank you guys for giving us this opportunity.
Thank you.
All right, thank you, Health Department. And Alderman, we'll go on to the next item on the agenda. Steve?
Okay, I am going to say thank you to Steve Prang, who if you can see the video, he's sitting there on his phone getting ready. Steve, you are going to be up next. Steve Prang is the chief engineer at CMT Engineers, Crawford, Murphy, and Tilley. And so the next topic is the Ozark Center TDD. You guys may remember that we briefly talked about this in the past, where the Ozark Center TDD is a transportation development district that was put in place and established when the Ozark Center, where Walmart and Lowe's were several years ago. When it was started, I believe that there was a 0.5-cent sales tax. When the economy took a downturn, they increased that 0.5-cent sales tax to a 1-cent sales tax to make sure that they will be able to receive the revenue necessary to make their bond payments. Since that time, the economy has surged and they have been doing very well with collecting what they needed. That means that they are on the fast track for paying off their original bond debt, about a year away. So when the developers approached the city about possibly making improvements outside of the district, or outside of what I would say the boundaries of the Ozark Center plat would be, we said, well, what would be the benefit to the city in that? And that's really where we're at now. they had made a proposal that, considering the fact that we are at a point where the roads inside the Ozark Center could or should be replaced and or maintained, that we need to bring things up to ADA compliance, that there are opportunities for other pedestrian improvements, as well as other, I would say, collector level public improvements that can be made in and around this area that would support and serve the Ozark Center better and give people better access to that, then maybe there's a win-win here for all of us. And so what we did was we received a letter of intent, proposal, if you will, from the developers. And Steve will talk a little bit about that in his PowerPoint presentation, and tell you where we've been, where we're at now, and what the staff responses were to that original developer proposal. And so that you can see where we're at now, because we think this is a good idea, but we certainly want to make sure that the public is going to get the biggest benefit out of this as well. So Steve Prang, I'm going to turn it over to you, and thank you for waiting so patiently, so you can go. I gave him the intro, and now we're on. So.
Okay. All right. Sorry, Steve. Can everybody hear me okay?
Yes. Yes.
Okay. That's great. Thanks, everyone. Sorry, I got, of course, timing is horrible. I got a call right there when you guys were wrapping up on the COVID situation, so apologize for that. Steve, thanks for the intro. I don't know what you said, but I'm Steve Prang.
I think led up perfectly to what you're about ready to present. So if you can put your presentation on there and explain to them where we're at and where we're going, then that would be great.
Sounds good. All right. Well, we're with CMT. We work with you guys on a lot of different transportation projects that you have there, and we're excited about the 14 project coming to life, and work with Steve and his great staff there at the city. So I'm going to share my screen here, and I want to see if all of you can see that. Can you see the presentation then?
Yes.
All right, perfect. Thank you. All right, so Steve had asked me to give a little update on the project here that they've had some discussions with a developer on. It's the Ozark Center TDD. And so I wanted to start out with a little bit of history on this. The district, and this is really the development district just on the south side of South Street there near 65. So the district was created in 2003, and it had the purpose of funding the original project, which was the South Street from Business 65 to 19th. And so, as you all know, the TDD sales tax at the time when it was created back in 2003 was 3/8 cents, and it was increased to a 1 cent sales tax in 2013. And then the Industrial Development Authority issued bonds in 2014 for $5.9 million. And the bonds were expected to be paid in the next 30 months to complete the improvement projects. So recently, what's brought us to the table here today has been the ask from the TDD and the developer.
Hey,
So
Steve, hang on 1 second. Your PowerPoint presentation went away, and all we can see is your screen documents right now.
Oh, okay. Let me see.
There you go. There you go.
Right.
Thank you. Okay.
No problem. So I just went through the background part of this slide, and the bottom part here is the ask of why we've kind of been brought to the discussion table today. But the district basically wants to undertake new projects to expand the district. So they want to increase access to the property. They have three goals, really: increase access to the property, improve the traffic circulation, and facilitate development of the adjacent property to the Walmart and the other businesses in the area. So to do that, they need to execute a new transportation development agreement with payment to the developer from bonds funded through the TDD sales tax. So they want to pay for these improvements the same way that they paid for the original improvements in 2003 with the proceeds of the sales tax that's developed from the anchor tenants in the district. So at the end of the day, the transportation improvements that they make with this money will be dedicated to the city as public right of way. And then they're required to submit a proposition to the voters of the district to increase the number of projects. And they're looking for support from the city council to support the new projects that they have listed in their proposal, and then enter into a good faith extension into this new development agreement. So what they're asking basically is, look, we want to extend improvements into this district. We want to use the proceeds from the sales tax to do it. At the end of the day, you're going to own and maintain everything in this public right away. And there's a lot of intricacies involved with what they're proposing. So today I wanted to walk you through what they're proposing, and then kind of also paint the picture of where the city is and what they'd like to see out of this. And, and at the end of this, we really want to come to a decision on maybe what a counter proposal might look like to the initial proposal from the developer, because we think right now it is pretty one-sided with a lot of concerns that we see as far as the city's future vision for this area. So it's a great time to tackle this. So those not familiar with it, this is South Street and the interchange there with 65. Here's the Walmart and the Lowe's. And so right now the project of South Street is being completed, and the extension of these new projects that the TDD is proposing are phased. So the developer is proposing phases 1 through 5. And so the first phase would be basically an extension here, or a resurfacing or an improvement of the existing 19th Street all the way down to where it kind of takes this S-curve to a dead end. If you can see that. Phase 1B would be the development of a new subdivision that would be about 175 lots of a combination of residential, single unit and multi-unit housing. And then phase 3, the way that they have in their proposal, would be an extension here of the Oak Hill into the Oak Hill subdivision. Phase 2, I guess, which would happen before that, would be up here to the north, which would connect 17th Street all the way to 15th Street and provide this connection into Oak Hill. Phase 3 would be a continuation of that south to make connectivity down to the ultimate phase 4 east-west, and then phase 5 down to the south. So they have, in the initial proposal, they anticipate that they will generate right now $20 million of revenue, which equates to about a little over $1 million a year to pay for these improvements from the TDD. Okay, that's the developer's proposal. In gray and in blue here, I'm showing what the city would like to see as part of this, from the roads and streets and intersections perspective. So obviously, when you make these roadway improvements down here to the south and you build this big development, it's going to create issues for the transportation system, particularly a one-way dead end street here. If you just do phase 1A and 1B, you're going to have a lot of traffic going here on 19th Street that's going to come up to South Street and really have to either use Marler over to 17th or make this left turn out of 20th. And so there's really a need for an intersection here, an improvement to the signals there to allow for that full access to happen. There's also, some issues with how that will connect to the Oak Hill and this east-west at some point in time to create a little bit more of a circulation. And so, from the road and intersection perspective, there's a lot of concerns that the city should have about just having a commitment to do phases 1 and 1B and 2. There's a lot of other things that we think we need to consider before we support this proposal.
Hey, Steve, can I interject real quick here?
Yes, sir.
I just want to make sure that when you look at this map, this was a map that was put together in conjunction with the discussions with staff. And really, the letter of intent that the developer sent us they started with 1A and 1B, and that was it. And the city staff said, you need to go further. We can't just support using your TDD to build a new subdivision that of single family streets that you're going to turn over to the taxpayers after they've already paid for it once, and then they're going to pay for it again over a period of time. So we need to have some more significant public improvements that would be that would benefit the general public, not just your subdivision. So that's where Steve is now taking this within a bigger traffic study, is that they just wanted to do phase 1A and phase 1B and call it quits. And we said, no, you're going to have to go further with that. And so they added this in their proposal. But again, they wanted to have 100% of the proceeds go to them to complete 1A and 1B. And then if and when the revenue continued to come in, the city would get to do some other improvements if they wanted to, but it wouldn't be at the developer's expense. So I just wanted to make sure. Steve's got the comprehensive map here. I just want to kind of let you know how we got here, because at first they were just focused on theirs. What we're trying to do is say, no, this needs to be a win-win, and it needs to be based on the data that the engineer is going to gather through the traffic study. Because if we're going to explain to the public that we're going to keep a tax in place, that tax needs to be, or let me say the developer has proposed keeping the additional tax in place. If we're not going to oppose that, and there's going to be a public benefit, then it needs to be a true public benefit, not just one for the developer. Anyway, I'm sorry. Felt like I needed to say that.
No, well said, well said. And that's where we're really going with this. So, you know, we're taking their original proposal and saying, all right, we hear you. We hear what you want to do and why you want to do it, but we can't take those proceeds from this and just apply it to yours. We need to take a holistic look at being proactive about developing really a vision for this whole area, and, you know, and getting commitments for these improvements. So as Steve said it exactly right. So that's the road and intersection perspective of what, you know, we would like this proposal to look at. When you dive into other issues and other you know, needs that the city has in this area, the other ones that come to mind are sidewalk and ADA improvements. You know, right now there's a few, you know, these red lines represent existing sidewalks that are in place, and then these dashed lines represents gaps or holes that, you know, we need to fill to create that ADA compliance and also create connectivity for your city, you know, to this new development in this whole area. So some of these are already in the works and funded, like this one on the side of the school, this one along South Street here. But then really once you get into this area, there's a lot of gaps. And so as we move down to the south here, we also have a multi-use path that's in your comp plan with a park, you know, that is proposed for this area, and that's in your comp plan. So, you know, we'd like the proposal with the developer to address how they're going to implement some of these improvements as well. And then obviously on the utility side, there's a huge need in this area because there's a lot of growth down here. And so, you know, the developer in his proposal really is just given a general estimate that includes, you know, really minimal water service to this new subdivision. But, you know, in talking to Jeremy and Steve, you know, we have 5 different projects that are planned that are not in for the water side to give service to this area. And there needs to be kind of a detailed look at, you know, there's about $500,000 in 5 of these water projects that we think that the TDD could also be paying for, or help offset the costs to provide service down to the growth area. So we need to look at the whole system in its entirety, try to take a look at these new corridors that are being created with these new roadway access points in and out of Oak, out of the existing subdivision, and how we can connect and maintain redundancy in your utility infrastructure with this project. So it's a great opportunity. You know, any development is a great opportunity to partner, but we want to make sure that we're partnering in a smart way based on, data and something that will result in a community benefit. So like Steve said, I've prepared 2 slides here that are really going to sum this up. And on the left here is the developer proposal. So, here's what the developer's proposing. Here's the key concerns that the city is talking about or having with this particular issue. And then here's the win-win. How can we get to a counter proposal to the developer to get a community benefit out of this and not just a developer benefit out of this? So I'm going to take each one of these, there's 5 of them, one at a time, and just try to explain a little bit on what an approach might be, and then maybe open it up for discussion and Steve to put a bow on this. But, so the developer proposed really phases 1 through 5. And they said, look, phases 1 through 2 will be completed within the first 36 months. And then they define the scope and the priority of how they're going to do those. What are the concerns with that? Well, the concerns are the city really would like a holistic perspective on the entire transportation system and not prioritize these projects with what the developer has in mind, but prioritize these projects with what's right for the city, based on data driven and a traffic analysis of kind of the whole area of what's there now and then what this future development might look like. So one recommendation would be that the TDD can fund a transportation study that would prioritize a list of projects, and the city could collaborate with the developer on trying to come to a mutual understanding and not just say, yeah, we're just going to do phase 1 and 2 here. Let's try to get more on the list. So that's number 1. Number 2, the developer has prepared these concept level estimates, that are going to be funded by the sales tax revenue. So the concerns with that are, a guarantee or protection on the city's end that cost overruns due to this preliminary estimate that the developer is given are going to be enough. And so what I've seen in other development agreements or letters of intent is the city would perform an independent cost estimate on these projects to see if they line up with what the developer is saying. And then sometimes, depending on the situation, the city may demand that, hey, look, if any of these costs, get out of hand, you're going to be responsible for the overruns on it. It's the same type of situation you get into when you do a cost share with MoDOT. You guys are put into that situation where MoDOT says, yeah, we'll participate on the cost, but only to this amount. And then any of the overruns are your responsibility. So, you could potentially take that stance here with a counter proposal to the developer to try to limit the costs and make sure that you're being cost conscious on this whole thing. The third thing you wanted to bring up is that all that automobile traffic from the 170 lots that's going to be developed in phase 1B will all use that 19th Street at the intersection, take it up to South Street until that future phase 4 makes a connection to the east. So back to the map real fast, if they just do 1A and 1B, all of this traffic will have no way to get east except for when they get up here. So that's going to create a couple issues for you. So the concerns are a one-way into the arterial, congestion issues in an already developed area with Lowe's being there. And then also it's a public safety concern. We like to have 2 ways in and out of a development for our fire and police in case they needed to respond to an emergency in the area. So creating a loop and a second way in there as part of the transportation network would be a concern that the city has. So here on the counter, a way to deal with that would be a commitment for funding that intersection improvement there at South Street to relieve the roadway improvements. And again, I try to be fair about this and really say, hey, look, we're supporting the developer's goal number 2 here. The goal number 2 of the developer was to improve traffic circulation. Well, we can almost make a point that, you're not really improving traffic circulation by just building 1A and 1B. You're actually hindering it and making it worse. So let's find a solution that we can all agree on that the TDD can fund to help with that goal number 2. The last two, this is Steve's point right here. The developer's proposing that the TDD pay for at least 50%, if not more, of the roadway and stormwater improvements in the subdivision that they're proposing. This is very uncommon. I don't see this in many communities that I work with. These are normally costs that fall on the developer, and unless there's a public benefit to this being subsidized, I would definitely recommend that we move in a different direction there and negotiate that this is on the developer. I've seen this happen a couple different ways. I have seen these things subsidized sometimes if communities are in desperate need for inventory, or the market is not good for housing. They want to stimulate that growth, but the market's good right now. What they're proposing, they're going to sell like hotcakes. So, based on all the data that we have from our economists, it really should be a cost that's on the developer. The other concern here, I say it here in our approach, but careful setting this precedence of subsidizing housing development. So if you do this for this situation and you use the TDD money to pay for this subdivision, you are setting a precedence for future development that other developers could come in and say, hey, look, you did this for this guy. And, you got to be careful about that. That's a slippery slope. But this also might be a negotiation to get a commitment for the additional roadway and intersection improvements. So you could possibly say, look, we'll play ball and we'll subsidize some of these costs, but you have to commit to these additional transportation improvements. And then the last one before I stop talking here would be phase 1B is showing 175 lots, 2.7 persons per lot. So that's 472 people. And so 472 people within close proximity to that retail center. Right now there's no plan for any recreational space or pedestrian access to the shopping center, and no commitment for off-street bike plans included in the TDD funding. So, all those people are really going to drive up, 2 blocks to the retail, or they're going to walk on the street. And so, we would like the developer to include some improvements for these 472 people to make their way safely to the development district, and again, create that pedestrian connectivity that we talked about before. It's consistent with your comp plan. So where do we go from here? I think what we're trying to do is we're trying to take the developer's proposal as written right now. We're trying to work with him in a way to get to the point where you guys can get behind a proposal here. Where we've identified some of the concerns we have with the proposal. And the next step would be to take these back to the developer and see if we can find some common ground and a win-win for everybody. And like Steve said, we want to make sure that the sales tax is going towards a community benefit, and that's not just one-sided here. So that's the reason we're meeting today. And I put together this summary to just try to bring you all up to speed on it and give you some general information on it, and then have a discussion on how staff can move forward. So Steve, I guess I'll kick it back to you.
Well, I think when we first talked about this, and I know that when it was first proposed to me, it seemed like a good concept, and I still think it is a good concept. And I think that when you have a TDD that is established to make public improvements that for a commercial area that has basically served to 50% of our total sales tax revenue, it's smart to be able to keep that mechanism in place if more public improvements can be made. The real trick in this, as Steve has explained in his presentation, is how do we structure that? How can this be a win-win for everybody, to where if we're not going to object to the developers extending their TDD by adding new projects and indebtedness, then how do we benefit the city of Ozark and its citizens from that? And this is why we're trying to put this together. So I think now, if everybody is still on I guess, the same page that it sounds like a good concept, and that we don't want to lose $20 million over 20 years, or at least access to that a majority can be put towards public improvements. Are we all still there, knowing what you know now and seeing the presentation? RJ, I know you hadn't seen this, but I just want to know where everybody's at, because we're at a point where the developers are saying, look, we have to know something. We're going to run out of time, because if we pay off our debt in a year, this might take 6 months to be able to get everything put in place and figure out how we're actually going to do this and negotiate the details of it. So, and the very first part of this is that we've gone back and said, we know we need the comprehensive study on the south side of town that takes all the phases into, and all the future land uses into perspective, and we get the hard data we need to be able to prioritize what phase needs to go when. And that's why we've asked the TDD to pay for that study. So the city of Ozark would be paying for that. We got the scope of work, we got the cost estimate, and then we said, look, the first step is that the TDD needs to pay for this study, and then we can go forward. Can you guys give me your feedback on this? What you've seen, what you've heard, what you know now? Do you still want us to continue working with the developer on this? Do you see enough benefit in this?
Steve?
Jason, I see your hand. You won, you're first. I don't like the high taxes in that area. I think I've expressed that. I don't like giving developers breaks. Now, with that said, I'm in support of the project largely because we need to take steps to redirect population growth to that area of the city. We need to make sure that we take steps to maintain the viability of, like you said, our largest revenue producer. The developer came to us with this idea. It wasn't something that we pushed upon them. I see a lot more pluses than negatives. I certainly am still in favor of moving forward with my noted concerns.
Well, we share the same concerns. I want you to know that. And I think that's why we felt like we needed to really dive into this deeper and bring something back to you and say, hey, developer, you gave your original proposal. We've reviewed it. Now we're going to get the experts involved to really make sure that this is something that that our Board of Aldermen can get behind, because I know you have to answer to your constituents and you want to be able to give them an answer that you can support. So anyone else? Bruce, Ted,
Steve.
Oh, I'm sorry, Nathan. You're still okay. I'm sorry.
Yeah, sorry. I had to make a phone call. I swung back in. So yeah, I'm not in favor of giving taxpayer cash to developers. So 1B, I don't know what all they envision on that, but stormwater and roads in a subdivision, I'm not there. No way. The stoplight at the entrance into the center, absolutely. That needs to be on there. A connection between South and 15th, man, that's a no-brainer. That has to. You got to be able to make a left-hand turn out of there. They can't do that right now. That's absolutely got to be on there. I also think we have talked about trail connections and parks. And if this type of development's getting ready to happen on the south side and we don't take advantage of that to get trails and parks in there, we are making a massive mistake. So that has to be part of this.
Sorry, I'm sorry.
So
I agree with that,
in
and
favor
I think staff agrees with that. So Mike, I want to have a follow-up question to what you said. You're right. I think it's 1B, which would be the subdivision streets, the residential streets, not below a collector level. Now, so when they brought us that, we had our public works department, John and Jeremy, are on the call. They created a map that said, look, here are your streets that are residential collector levels. We believe that we understand that more people would use the main streets in and main streets out, and we get that. But these other streets in 1B are really just going to be used by the subdivision and the people that live in the subdivision. And I think that's what I'm hearing you say. So we also push back. The only thing I'll tell you is that I think that's probably going to be the developer's main negotiating point, is that if we can't pay for all of the transportation improvements in our subdivision then we probably won't do the subdivision and we won't continue with the TDD. And I'm not saying that's okay. I just wanted to make sure you were aware of that.
I think the argument I would make is that the developer is going to recoup their cash when they sell those lots, right? That's when they're going to make their bank. And the big money to be made off of that is maximizing the value of those lots. And you can do that with trails and parks. They can maximize the values of those lots with their access to public amenities.
That's why we're on this call, because we've kind of gotten to that point where we've negotiated and negotiated and negotiated, and now we're like, okay, where are we at now? We've brought in Steve and CMT as the experts to say, boy, here's what you really need to be asking the questions, and put this back to the developer and see what they're willing to do.
Absolutely. I think there's an opportunity we talked about this at P&Z Monday. There's an opportunity to work with them here and build an area so desirable that people would pay any amount of money within reason to want to live there. And that's the opportunity to have, not to funnel the taxpayer dollars to city, to a subdivision, but to build a region, an area of the town that's highly desirable. That's got to be the goal here. And that's where we got to get the developer and us working together.
Yeah, Nathan, I would add on that trail and connectivity thing here on this slide I have up. Another, you guys are dealing with it all over, but here on South Street, one of the keys is in the future is really to the north too, right? And so not only creating this connectivity to the south, but man, if we could try to get this pedestrian access across South Street, like what we're dealing with on 14 right now on Jackson, and trying to make that connection to the school and the south side with all of those trails, trying to plan for that now is a good thing. And as much as we can get the TDD to partner on that is a good thing. And so, if you're not looking at that, I think you nailed it. You're just missing an opportunity to try to paint the holistic vision here. So you don't get boxed in and you got to deal with a tight corridor later.
So that's my 2 cents, Steve.
Thank you.
The Steves.
Ted, Bruce, Ted, you got your hand up.
Yeah, I was going to say, I don't want to sound like a downer, but if we don't get, my personal opinion right now, if we don't get the use tax passed, I'm not interested in adding any more residential developments, period, for a while. We need to catch up. And, we all know that specifically single family residences cost us money. And I think I would be, in principle, I'm real hesitant to do anything like what they're proposing anyway. But the bigger one is, unless we get the use tax passed, I'm just kind of almost like, I don't want to add more rooftops and let all that money go to Springfield and all that money go to online and let the state collect it and us not, and us have all this cost, because at some point we're going to reach a convergence where our cost is too great, and I don't want to get there. Meaning our cost to provide services is too great, and I don't want to get there, because the reverse will start happening. We'll start becoming like what downtowns became many moons ago as everybody moved to the suburbs. We'll be the opposite of that. So I'd just be cautious, but in principle, I don't like the phase 1B portion of this either.
Thank you, Ted. Bruce, Heather. Bruce, you're next. You raised your hand.
I support the project regardless of whether the use tax passes or not, although I take Ted's point that, an internet sales tax just is needed for this town. I echo Nathan's point that, if we don't, with developments, continue our policy of insisting that at least there be easements enough for bicycle pedestrian pathways, we're never going to create a community that offers at least the kind of amenities that many people expect in their communities when they're looking to invest. The reason why, though I support the project, is that it supports retail. And then I feel that, you know, the city has to find a balance in its negotiating position. The public would expect that if we're imposing higher taxes in an area that they are paying, that they receive a public benefit. At the same time, I think this development is important. And I don't want to get into the weeds of what to give up and what to gain. I would just hope that as the city negotiates, that in addition to considering the intersection that is needed, and it certainly would be, that it also consider its long-term planning in terms of providing amenities to the public, amenities that the public expects. And that's my 2 cents for what it's worth.
Thank you. RJ?
Coming in kind of new to it, the only concern I would have on it is that we have something where we have commercial property, and that's what we're gaining our revenue for it. And initially, I could see where that was a big benefit for us as a city because we have more commercial projects being done. This not adding any more commercial to that is a bit of a downside to it for me, from my perspective. I wish there was a little bit more into that because it looks like it's really a good way for them to take what they're making off of the commercial stuff, not add any more commercial to it, add more rooftops and get a lot of their infrastructure paid for, you know? Yeah. And I get that that's the underlying reason why they're willing to do it. But that's just the only concern I would have there, is that it'd be nice to see a little bit more commercial come around, or at least have the potential for it in that area.
Okay, thank you. Heather, do you have anything to add?
I'm sorry, I had to leave for a lot of that. I have the store open and I had to go out and help. What I heard of what Nathan was saying was on the parks and the trails. I agree with that, but I think we should go ahead. I think it's a good project. So for what I heard, that's my input.
Okay, thank you.
Yes. Steve,
do you have anything to add for the board? I think, you know, we received some good direction. That's what I wanted. I tell you what, if you guys want to see the PowerPoint presentation, I don't think Steve's going to have any problem sharing that with you, so we can get that PowerPoint presentation. That way, it'll put those slides that let you know, hey, look, here's the benefit, here's the concern, here's the proposal. You can see all that in front of you. It just makes it easier to look at that. So not that you didn't hear it, but I want to make sure I get it to you, and I want to make sure I get it to Amanda, because I want her to be able to see it all, you know, to make sure that we're doing everything right by the state statutes that govern the TDD and everything. So,
yeah. I've got a question for Cameron. Cameron, the property that's to the east of the extension, in other words, if they build this subdivision in what would be project 1B, the land that is directly to the east of that, across the street, that's owned by someone else, what is that on the comprehensive plan? I believe part of that is high density residential or apartments, but I don't know what the south part of that is.
I think it's all high density.
You're
muted, Cameron.
Cameron, you're muted.
Okay, we got you. We can hear you now.
Cameron?
The plan for that was to be a commercial office warehouse area. We haven't had any requests or any development on that at this time, but there was initially a request to look at the office warehouse scenario.
Now that was in the northernmost 40 acres, wasn't it?
The northern 20 acres.
20 acres, okay.
What about south? What's that zone? Isn't that high density?
Isn't that R4?
There is an R1D to the south. The in the current zoning, if you guys can see Steve Pring's email or his screen, what keeps flashing around, but the current zoning notes the southern portion as R1D residential. In our comprehensive plan, it's meant to be mixed use, primarily consisting of commercial office warehousing. and then a high density residential. You can see on the screen there that cyan color, that is R1D. And then the northern orange color is office warehouse. That's
Okay, that is the existing zoning.
existing zoning.
Okay, and
The other,
purple
the other image that he's pulling up now, that pinkish color, that's just noted as mixed use.
Okay.
Civic zoning, but generally that would consist of, again, commercial, high density residential and office warehousing.
So in your opinion, if there is a development, a single family residential development that goes in on the west side of that road, which would be their project, project 1B, it would probably make sense to me, and I don't know if that it would probably tend to be the same thing across the street. I mean, it's not likely to be light industrial immediately across the street. I know the northern 20 acres is already zoned, the part that's up against the detention and that old lead mine, but the southern part is more likely to stay residential, whether it's R1B or any kind of new designation, it would still be single family residential in most likelihood. Is that your opinion?
My opinion would be you'd have to do some kind of buffer between the existing single family to the east to make some transition. My opinion for the best use would be a more multifamily scenario or commercial scenario, in office warehouse as well. But single family, this has got great access to a signal, to a highway corridor, possible visibility from 65. The best use of that property would be more of the multifamily or the commercial scenario.
Okay. Something with a higher tax base than single family.
Just a greater use for the property, more of a dense type use for the property.
Okay. Okay, Steve.
Okay, well, I think is that all the questions anybody has? It is 10:33. I am done unless anybody else has anything. So thank you so much for taking the time this morning to be on this Zoom call. Steve, I want to thank you for jumping on today. You learned a lot about county health departments and COVID testing too. So I hope that's helpful for you in your in your personal life.
Yeah.
Thank you for being there. But guys, thank you. If there's nothing else, we will end the meeting.
Yeah, let's adjourn. Yeah, we need to formally close the meeting. Do I hear a motion to adjourn? Somebody raise their hand.
So moved.
Nathan and
Second.
Smith. Yeah, all right, we are adjourned. Thank you, ladies and gentlemen.
Congratulations,
you. Bye-bye.
James.
Thank you, guys.